Good morning and welcome back to the Now Morning Show. It is Tuesday, September 10th, and that means it is in fact World Suicide Prevention Day. We all have a role to play in preventing suicide. So this morning, to lead the discussion, we are joined by the Regional Manager for Mental Health Services Department, Joanna Maharaj, and Dr. Varsha Nanan, the Acting Registrar in Psychiatry, both of the Southwest Regional Health Authority, as we are talking suicide prevention in commemoration of World Suicide Prevention Day. Good morning and welcome to the Now.
Good morning.
Good morning.
I appreciate you both making the time to have this conversation, because this year, in terms of a theme, we are looking at the role that we all play in supporting the International Association for Suicide Prevention and making sure that we change the narrative. So I'd like to start with you, Joanna, because in terms of mental health services of the SWRHA, I imagine that suicide will be a top priority. What should we, or how do we exercise that focus and underscore the role that we all play in prevention?
Good morning, and thanks for having us. World Suicide Prevention Day was established in 2003 by the International Association for Suicide Prevention in conjunction with the World Health Organization. Each year, the aim is to focus attention on the issue at hand to reduce stigma and raise awareness amongst organizations, governments, and the public, and give a singular message that suicide is preventable. As you stated accurately, this year, the theme for World Suicide Prevention Day, and actually the theme for the next 3 years, is changing the narrative on suicide. Changing the narrative on suicide is about transforming how we perceive this complex issue and shifting from a culture of silence and stigma to one of openness and understanding and support. So the message is very clear. It starts with us. At the SWRHA, we have had numerous outreach programs targeting suicide prevention and raising awareness. In the last 2 years, we've had seminars for the youths attending secondary schools in the southwestern region, where over 400 students attended these seminars, and it was well received. We've also had our team going out to schools within the Southwest Regional Health Authority and providing workshops for the children in the secondary schools, giving them strategies on how to cope with stress, how to deal with self-esteem issues and suicidal thoughts and self-harming thoughts. We've also done numerous outreach programs with our communities in our respective clinics. This year, for World Suicide Prevention Day, we are changing the narrative at SWRHA. Our team here has started staff sensation sessions, whereby we started the discourse about mental health and suicide awareness and how important the role that we play in reducing stigma. So our message is loud and clear at SWRHA. It starts with us. We are raising the awareness of mental health and the importance of mental health in our organization, our homes, and by extension, our country.
I appreciate that. Now, Dr. Nanan, I want you to give us a little bit more specificity in terms of who's at greater risk locally of suicide, that is, because I realized that Joanna spoke on specifically talking to students, but I get the feeling that you will have some numbers that might show us otherwise. Who exactly are we talking to or need to be talking to most?
Yeah, so there are various risk factors for suicide, and those who are at greatest risk are those who have multiple of these risk factors combined. So some of the risk factors for suicide, the most important being having a prior suicide attempt. So once a person has a prior suicide attempt, this is the greatest predictor, the greatest risk factor of a future suicide attempt, especially if the person has ongoing psychological issues. Having a mental disorder, for example, depression, bipolar, anxiety, schizophrenia, certain personality disorders, all these disorders are associated with some level of emotional dysregulation. Abusing substances also increases a person's risk of suicide. When in an inebriated state, a person is more impulsive, there are lesser inhibitions, so you're more likely to act on fleeting suicide thoughts that you would have dismissed if you were in a sober state, as well as using substances like marijuana, alcohol. If a person is already feeling depressed, you'll just amplify these emotions more, make them feel more hopeless, increase those feelings of despair. Gender is another risk factor for suicide. Being male increases your risk of considering and attempting suicide, having a family history of suicide. Those who have chronic health conditions, chronic meaning something that is long term, a condition that is ongoing. All of these things, chronic pain decreases a person's quality of life. They have less feelings of control, more hopelessness, again, increasing the risk of someone considering suicide. Persons who have traumatic events in their past, current ongoing life stressors, those who have no social support or less social support. If you're those who are not aware that what they are going through is a treatable medical condition, having less awareness, those who feel stigmatized and discriminated against, they are less likely to go out and seek help, increasing the risk of isolation and hopelessness, and again, contemplating the idea of suicide. Having decreased access to mental health resources that are readily available to you, as well as various minority groups, they are also at risk of suicide because of the discrimination and the stigma and the bullying that they may experience.
Right. Now, I will focus a little bit on two specific groups because there were actual, well, details that we can focus on. Hear me out, but when you mention persons who have chronic diseases or even persons with mental disorders, my first thought was diagnosis is necessary in a lot of these cases, and we may find that persons do not necessarily have the resources to, or even the understanding that these conditions are that serious, needing medical assistance to even begin that process of thinking, woe is me, because they can't manage it. Are you saying to us that statistically speaking, we've seen that persons who have been diagnosed with chronic diseases or mental disorders pose a significantly higher threat than persons who are undiagnosed when it comes to suicide?
Yeah, so both persons who are diagnosed and undiagnosed with mental health disorders as well as chronic health disorders, they are certainly at an increased risk of suicide because most of the times these people they may not get the help that they require. They do not know that what they have is a disorder. They do not know that there's help available, and it's very important to intervene at this time. Emotional intervention at the right time to give these people hope, to let them know that they have other options to reconsider what they are thinking is not hopeless.
Right. And in that case, let me jump back across to Joanna, because once we start talking about that lack of hope and somebody that seems to be troubled, we can probably start talking about hurting one's self and those sorts of visual or more evident signs that suicide might be on the mind of a person that we are close to. Tell me a little bit as to some of the, well, yes, telltale signs or more obvious signs that we can look to for being able to stage an intervention, perhaps.
Some of the signs that we may see is that the individual may be more isolated, they may be withdrawn, they may express their feelings of hopelessness, they may not interact with their loved ones as they normally would, they would not engage in their normal routine activities such as they may be diminished in motivation, they may not function in their working environment as they may normally do. There may be increased usage of alcohol and substances such as alcohol, marijuana, cocaine. Some may be sleeping more. There may be changes in their eating and sleeping habits. Some may be a bit more reckless. Some may be very, very quiet. And these are some of the signs we have to look out for. They may not maintain their personal hygiene. They may lack the motivation to use the washroom or shower. They may not want to talk about their emotions. And these are the things that we should look out for, the warning signs that our loved ones may be in danger. They may say that, what's the point of living? I feel so lost. I'm alone. Some of them may not speak about it, and that in itself may be a warning sign.
I appreciate that you identified the obvious telltale outright spoken cries for help, if you will, as well as those that are unspoken. But considering that I am not in any way a healthcare professional, what are some of the steps that I could take to be supported so that I could provide better support for these persons?
So, starting with communication, you need to be non judgmental, open, honest, and show a genuine interest in that. I care, I'm here, I'm listening to what you have to say. It's okay not to be okay. Starting there goes a long way because individuals who may be contemplating suicide or may have self-harming thoughts, they sometimes just want to be heard and listened because they feel so overwhelmed with their pain. They feel that they can't cope. And by having that loved one, or it could be a teacher, it can be someone in the community, a neighbor, just having that listening ear and someone showing empathy and understanding to what they may be feeling, that goes a long way because they often feel that there's no point. What's the sense? There may not be no change in how I feel.
Got it. Dr. Nanan, would you like to add to that in any way? Some of the ways that we can really be a pillar of strength for those in need?
Yeah, definitely. So, with persons who are struggling with their mental health, it's important that you come from a place of care. You ask them questions to demonstrate your empathy. Talk to them in an open and non judgmental way because the goal is to make these persons feel safe, to make them feel supported, for them to come forward and share what they're experiencing. You could ask them questions. You have a friend, you have a relative going through a tough time. Ask them. You don't have to talk about the problem itself. You could just ask them general questions. How have you been coping recently? How have you been feeling recently? Have you been feeling stressed? Have you been feeling down? You can ask them about changes in their sleep, changes in their appetite, their energy levels. As Mrs. Mirage was saying, if they are withdrawing from friends and events that they previously enjoyed doing. All these things give you cues that their mental health struggles are now heading in the direction of an actual disorder that requires professional intervention because it is now affecting their daily functioning. Again, if you suspect someone is struggling with suicidal thoughts, you have to come out and ask them directly, but in a gentle way. So, you find these days that you've been struggling so much, you feel like you can't go on. You come out and ask them, have you been considering ending your life? Have you been having thoughts of hurting yourself? And then you could lead the discussion into asking them and sit with them. Do you think professional help might be beneficial to you? Do you want me to help you find someone that you think might help you to talk about it? And then check in with the person because sometimes people may not be ready to accept help right away. And if you check in with them, give them some time to consider the various options available, this might be very beneficial.
I appreciate that timeline, if you will, of events that we could look forward to. But let's say we get to that point of suggesting treatment. Where do we start? Doctor, could you give us some of the institutions or contacts or some of the institutions that we can look to?
So, the treatment, it is comprehensive. Again, it depends on the level of risk, depending on the severity of the symptoms. If the person has underlying mental health conditions that are undertreated or undiagnosed, as well as a person's individual circumstances.
Right.
So, in the event someone is in immediate danger of attempting suicide, or you think the person, or even if you're not sure, get the person to the nearest emergency department at a general hospital or call the emergency services, which we'll go through later on in the segment. These persons require immediate professional intervention. They may require hospitalization, stabilization. So, in the event where the threat is not so imminent, there are various other options available. There are crisis hotlines, suicide hotlines. Some of these hotlines are available 24/7. They provide a safe space for someone to talk, to feel supported. They can also arrange for in-person sessions to be conducted at the nearest available place to this person. Most healthcare professionals, counselors, they could come up with something called a safety plan for the person. So this is letting the person have a plan in the event of a mental health crisis. What can they do when they are experiencing intense emotional distress? So letting them know, become observant, aware of the cues in their body before it reaches that level. So what happens to them before a mental health crisis? And what can they do in the immediate interim just to self-soothe, whether it may be going for a walk, Who can they call for help, including friends, family, a list of professionals, in the event that these suicidal thoughts they do intensify? Another important part of the safety plan is with the friends, the relatives, the person to decrease all access to lethal means. This means clearing everything in the environment, everything in immediate reach that they can use and grab to self-harm and end their lives. Because most of these thoughts, they are impulsive, they are fleeting. So if there's something available, you reach and you grab, and that might be like you didn't get to consider the consequences, how permanent this action really is. But if this person has to go out and look for something, by the time they actually find something that they could use to self-harm, the urge would have passed.
Okay.
Talking to a therapist, a counselor, a psychologist to increase various things, like increase your communication skills, your problem solving skills. You're teaching these persons how to build their resilience,
Quite a
how to
list there.
increase their communication. Yeah, as well as medication options as well.
Got it. Now, there is a lot that we could continue to talk about and a lot to share. So quickly before we wrap up, I want to ask Mrs. Marshall, though, in terms of persons who have actually been, well, able to admit to themselves that they are struggling with these thoughts already. What steps, what options, and where can they go to get this help themselves?
So there are various mental health clinics available throughout the country. For the Southwest Regional Health Authority, we have various psychiatric clinics available at the hospital and the different districts in SWRHA, Point Fortin, Cedras, Gasparillo, Princestown, with counselors, psychologists, medical professionals. Help is available in person as well as in the telemental health. We also have a service available 24/7 through the accident and emergency department at the general hospitals.
Appreciate that. Well, I'm going to wrap things up here for now because today is just one of the days that we will continue to lend our support. But with the information you've both shared, we certainly can play a more active role in world suicide prevention and mental health support to persons that we care about. So let me say thank you very much to the Regional Manager of Mental Health Services Department at the SWRHA, Mrs. Maharaj, and of course Dr. Vasha Nanan, the Acting Registrar in Psychiatry for the same division, giving us some insight and information we could use here on the Now. Thank you, ladies, for joining us.
Thank you for having us.
Thank you.
Appreciated delightfully. Up next, though, because it is Tuesday, we are talking unique, not different after the commercial break. So stick around, guys, and now we'll return. From all of this.